Greetings, this is Dr. Anna Maria Mihalcha. I'm the president of AM Medical, LLC in Yelm, Washington, and today we're discussing exosomes, the new frontier part 2, the applications of exosomes for chronic diseases. It has been shown that exosomes have profound regenerative abilities. This is modulated due to their cargo of microRNA, proteins, and growth factors. As I've discussed in my previous video, the regenerative abilities of exosomes have been studied in multiple organ systems. Factors that affect the secretion of exosomes are low oxygen states, high inflammatory states, stress in the tissues, as well as calcium levels inside the cells. This produces exosomes to be secreted. For our purposes, we are using perinatal exosomes with youthful information growth factors and microRNA. In clinical studies, it's been shown that in cardiovascular disease, exosomes reduce the size of the infarct, they enhance tissue repair and increase new blood vessel growth. In acute kidney injury, tubular epithelial regeneration was achieved. This means the areas of the kidneys that filter the plasma into urine. Cell death of those important cells was reduced, and there was a substantial reduction in fibrosis or scarring. This is important because the scarring is what causes chronic kidney disease to occur. And the atrophy, meaning shrinkage, of the kidney tubules was also reduced. In the liver, there was regeneration of the liver cells, scarring of liver was reduced, and cell death of liver cells was reduced. In the lung, the swelling with injury was reduced, inflammation was downregulated, the high blood pressure in the blood vessels of the lung was reduced, and the subsequent changes in the heart muscle, which lead to a thickening of the heart muscle, was improved. Overall, the lung vascular remodeling was also improved. In skin, the regenerative abilities of exosomes produced increase in skin growth, less death in skin cells, and increase in the proliferation of those skin cells. In stroke, which is one of the leading causes of death and disability, there have been beneficial effects of exosomes through the involvement of the neurovasculature, meaning the blood supply to the neurons, as well as beneficial effects to the stem cells of the neurons. These beneficial effects of the exosomes occur again via the microRNA that's transported to the injury site, as well as the proteins and growth factors that are present in the exosomes. The exosomes have been shown to mediate the plasticity of the synapses and the axons, which are part of the neurons. They are regulating the neurogenesis, the growth of new neurons, and oligodendrites are also important cells in the brain. They are engaged in brain remodeling after strokes and are affecting stroke recovery by increasing communication between different cell groups. Exosomes also communicate with the immune system after stroke. There are specifically in neurodegenerative diseases a great focus of new targets of treatment. In Alzheimer's disease, Parkinson's disease, and stroke, many of these applications have been studied because the neurogenesis, the growth of new neurons, is impacted. The fact that exosomes are able to beneficially impact the growth of new neurons is very promising. In Alzheimer's disease, abnormal proteins are being produced called beta amyloid tau proteins. These abnormal proteins impair the functioning of the neurons and cause symptoms of dementia. Exosomes have been shown to clear out of the cells the beta amyloid deposition and thereby improving the symptoms of Alzheimer's. Peripheral nerves, as well as neurons, spinal cord injuries, and brain injuries in general, have been previously thought to be very difficult to treat. Because the exosomes contain the cargo of microRNA that specifically enhances neuronal growth and neurogenesis, there are promising findings that affect peripheral nerves as well. This can be peripheral nerve injury or clinical neuropathies. In spinal cord injury, there are reports where exosomes are able to assist in the motor recovery, meaning the ability after paralysis to regenerate adequate neuronal connections so that motion in the muscles is possible again. Spinal cord injury victims often have significant pain syndrome because there's a hypersensitivity that appears to be downregulated. And there's a decrease in the neuroinflammation. Overall, in spinal cord injury, there are improved outcomes. Dr. Doug Spiel, interventional pain specialist, has the largest cohort of spinal cord injury patients with remarkable recoveries in function. Exosomes regulate the systemic blood pressure as well. In rats, experiments were done in which rats who had normal blood pressure, their exosomes were isolated and infused into rats who did have high blood pressure. The rats that had the high blood pressure normalized their blood pressure after getting the exosome infusion from the healthy rats. Subsequently, the test was reversed, and the exosomes from the high blood pressure rats were infused into the rats that did not have high blood pressure, and those rats developed high blood pressure. It is the cargo that appears to be mediating high blood pressure. When we are infusing perinatal exosomes, we often see an improvement in high blood pressure and a reduction in medications because the cargo of perinatal exosomes does not carry the abnormalities that are inducing high blood pressure in the target organism. There were other findings that showed that the structural changes of the thoracic aorta. The aorta is the main artery in the body, and when people have had prolonged high blood pressure, they develop changes like thickening of the walls and decreased abundance of collagen. Those changes were reversed when given normal functioning exosomes in these mice. There has been a lot of interest in diabetes. It's been shown that exosomes are able to help reverse diabetes symptoms. In this model, the infusion of exosomes produced a reduction in blood sugar levels. It decreased and reversed the insulin resistance and was able to accelerate the utilization of blood sugar. The changes were manifold in the liver, in the muscle, to be able to utilize sugar better. In diabetes, there's a destruction of beta cells in the pancreas. Those are the cells that are producing insulin. This destruction of the cells was halted. So there were multiple pathways in which exosomes were able to reverse the symptoms of type 2 diabetes. In heart attacks, exosome infusion reduces the scar size and improves heart pump function. This occurs by protecting the cells, by stimulating new vessel growth, by reducing scarring, by modulating the immune system that is infiltrating the infarcted region. This effect is thought to be brought about by the microRNAs and proteins in the exosomes. In peripheral vascular disease, in this study, arteries of a limb were injured, and the infusion of exosomes improved new blood vessel growth and prevented muscle damage, same as happened in the heart. This occurred by re-regulating many different gene pathways, many signaling pathways, hormonal pathways, utilizing vascular endothelial growth factor signaling. That is the signal to grow new blood vessels. The genes that were associated with that signaling cascade were the transforming growth factor beta 1. TGF-beta 1 is the gene that helps the salamander regrow its limb after it's amputated. This is exactly the same cascade that is being activated after exosome infusion to an injured area. In chronic alcoholism and binge drinking, what occurs in the brain is a chronic inflammation and dysfunction of vital cells of the brain by the toxicity of the alcohol. This applies to all other drugs as well, including cocaine, opiates, marijuana, and methamphetamine. This abnormal inflammation in the brain is what makes it so difficult for people to stay abstinent, because the inflammation remains even after people have stopped drinking. And because there's inflammation in the brain and dysregulation of the immune cells in the brain, there's a high risk of relapse. After exosome infusion, the inflammation in the brain normalized and the alcohol intake was inhibited and relapse was decreased by 80 to 90% over 3 to 5 weeks. There are many studies who show that mesenchymal stem cells are utilized in treatment of osteoarthritis and cartilage regrowth. The paracrine effects of mesenchymal stem cells occur via the exosomes and the cargo. When we're using exosomes, we can regrow the matrix of the cartilage. In immune diseases, autoimmune diseases, there have been many studies that show the benefit of downregulating inflammation in multiple sclerosis, lupus, chronic kidney disease, other autoimmune diseases, scleroderma. There is a abnormality and dysregulation of the immune system. Exosomes have profound immune regulatory abilities. They improve cell communication. They improve all aspects of immune function. And so in connective tissue disease and autoimmune diseases, there are significant benefits that can be garnered from the application of exosomes. In specific, the pro-inflammatory T cells are downregulated. All of the cytokines, the messengers of inflammation, are downregulated. And then the good T cells, the T regulatory function, and the anti-inflammatory cytokines are all upregulated. In the B cells, same thing. There are many effects that help for beneficial re-regulation and rerouting of the immune function towards a more anti-inflammatory picture. The cytokines, like the interleukins, are also downregulated that are pro-inflammatory. Macrophages are also affected. So we have profound anti-inflammatory properties that are allowing to give benefits in this whole huge group of chronic diseases. I hope you enjoyed this update in regards to possible treatment applications of exosomes. You can find us on ammedicalmd.com. Follow us on Facebook and subscribe to our YouTube channel. Thank you very much.